First thing I'll start off with is, could you please provide your names, qualifications, current affiliations, and your area of research expertise?
So my name is Isabelle Jalbert. I'm a optometrist. I have an OD from University in Montreal in Canada, a PhD and a Masters of Public Health, and also a graduate certificate in Ocular Therapeutics, which is, I think, relevant to what we're going to be speaking about today. I'm a university academic and associate professor at UNSW Sydney. I lead the program research and education, which is focused on improving the delivery of eye care in Australia, making it as evidence-based as possible. And as part of that, I teach a course in Ocular Therapeutics to optometry students here at UNSW.
So my name is Alex Hui, and I am an optometrist as well. So my training was with a Doctor of Optometry degree at the University of Waterloo, and I also completed my PhD at the University of Waterloo as well. I also have a graduate certificate in Ocular Therapeutics from UNSW, which I got only a couple of years ago. Research-wise, my focus research-wise is on contact lenses and myopia control, as well as drug delivery and ocular therapeutics. So those are most of my passions there. At UNSW, I am a senior lecturer, and I teach in the therapeutics realm as well as the ocular disease spaces.
Excellent. All right, well, it sounds like both of you are definitely well suited to the special issue that we're talking about today. And this special issue focuses entirely on ocular therapeutics. So what are some of the key topics that are covered in this issue that you guys can talk about?
Yeah, so I think some of the key issue we really aim to have something that would be an update on key areas of therapeutic practice in Australia. So I think we've got a couple of papers that are really, really timely. I'm thinking of things like a paper on pediatric prescribing, and given the real popularity of myopia control management and the focus on this in recent years, and given that use of atropine eye drops is one of the strategies that's commonly used in that space, I think it was really timely to have that paper published. There's a 20-year updates on the herpes eye disease study, which really gives some good updates on what are the common protocols that are to be used by optometrists for managing these conditions. And I think that will be really useful, certainly for us in teaching, and I think for practitioners out there who are managing those patients. Some framework on management of glaucoma. So some really interesting proposition on what evidence-based management of glaucoma should be in contemporary practice. And there's a lot of change in what the first-line management should be that are happening at the moment. So there's a really, really interesting paper on this by the group at the Centre for Eye Health. I don't want to talk about everything, Alex. Should I leave you a few things to talk about?
There's a fair bit there already.
Yeah, I think that transitions really well into the ones I was going to highlight, because you've talked about ones that are great to be used in practice, and I can highlight a couple that are kind of emerging therapeutic stuff that are starting to become part of practice, or may not be a routine part of practice moving forward. So there's one paper that talks about the use of povidone iodine or betadine for the management of adenovirus. So it's just about what's the evidence behind that and whether that should be utilized in clinical practice. There's also some talks about the emergence of things such as castor oil for management of dry eye, as well as another paper that is looking at Demodex. So about what's the latest and greatest on Demodex, what's our understanding of Demodex, and whether or how we should be managing these types of conditions or diagnosing these conditions as optometrists as well. So really a great mix of both things that we're already doing and things that might need updates, and then also emerging topics that might become more important therapeutically as time goes on as well.
And I guess the last thing that's in the issue that's really interesting is some interesting contributions from interdisciplinary people. So we've got a paper from a pharmacist on practical compounding for optometrists, which I think will again be really useful. We've talked already about use of low-dose atropine, which we've got to get compounded, things like betadine as well. So I think really interesting and useful article there. And a paper from an immunologist on the immunotherapy for allergic eye disease, which is one of the most commonly presenting conditions to optometry practices.
Yeah, right. So that includes something like hay fever, or I suppose which
Yep.
would be pretty mild, but yeah, that's an autoimmune eye disease. I suppose actually following on from things that have interdisciplinary relevance, we've got some updates to Optometry Australia's infection control guidelines in this issue of CXO, and that's definitely one of those things that applies across almost every medical practice. What are some of the major changes, if any, that we see in these guidelines?
I think the key change in the updated guidelines, and isn't it timely that they're coming out right now in the setting of COVID? But the key change is that there's a new section which is focused on what recommended transmission-based precaution. So not only talking about standard-based precaution, which includes things like hand washing and how you should disinfect and clean around your office, but what an optometrist should do when there's an increased risk of transmission, such as, for example, during a pandemic. So a really nice section on that with a really good table on COVID in particular, and what we should do during a pandemic.
Any changes?
I don't know if Alex has got anything to add to that. Yeah.
That's all I got. Yeah.
Just about covers it. No worries. So again, back on the topic of the special issues. And Isabelle, you've already mentioned that there are some big changes happening in the glaucoma space. What do you see as being the next phase of development for Ocular Therapeutics in Australia?
I think what I see right on the horizon now is probably oral therapeutics. So there's a big push nationally, I think, for optometrists to have access to these, because it's really, really needed for our patients to be able to access care timely and more easily. It makes sense. It's standard practice in lots of other countries around the world. We've been training our graduates to prescribe oral therapeutics for some years now. So we've got a lot of optometrists out there who would be able to do it if we had access to oral therapeutics. So I think that's probably what I see on the horizon straight up. I don't know if Alex agrees.
I think certainly, Isabelle, I agree with you on that one. And I think it's part of what we discussed as part of our editorial as well, about that being kind of the next logical step of things. And the other thing about this special issue is that we also have some data in terms of in New Zealand about how that oral prescribing of therapeutics by optometrists has been going. And so there has been some reports about what has been being prescribed, what type of safety concerns that there has been. And there hasn't really been any type of safety reports or complaints levied against optometrists in New Zealand since they've been able to prescribe orally. And they are, of course, they are trained to a similar degree or similar standard as we are here. And so it's sort of there's no lack in terms of our training, I don't believe, in terms of optometrists who are therapeutically endorsed being able to do this. And we also have evidence that we can do it safely and effectively. And so that does seem like the logical next step for what we can look forward to therapeutically for optometrists. Thanks a lot, Lachlan. Thanks for inviting us, and thanks for helping promote this issue. I think we're really excited, actually. So
yes, can't say it enough. Yeah, thanks, Lachlan.